Good morning, afternoon, and evening to the YouTube universe. My name is April Lynn Grubb. I am a senior nursing student at Indiana State University, and this is a clinical health education about adolescent health and safety for nursing 444 community health nursing. In the comment section of this YouTube video, there is a pre-test, post-test, as well as a handout. If you would please take time to take the pre-test before you begin the presentation, and then take it again at the end. I will remind you just to assess your learning. Did you catch everything you needed to know? And then also that handout is provided in case you need more information, resources, or you need to speak with other members of your family or the community about what we're discussing today. The learning objectives for today is defining an adolescent child, describing our well child schedule, vaccinations, as well as what to know about adolescent children, safety risks, safety event prevention, and accurate resources for adolescent care questions. So our adolescent child medical care, much like our school-age children discussion earlier, early adolescents are considered 11 to 13, middle adolescents are 14 to 17, and that's what we'll be focusing on today. Once we hit adulthood, they are still considered adolescents, but for this purpose, we're going to focus on before they turn 18. This age does continue to see their doctor at least yearly for well child checks, or more often if they're experiencing mental or physical challenges, including physical illnesses or problems with menstruation, problems in school with behavior, learning, or mental health. If an adolescent participates in an extracurricular activity, they may need a special exam, such as a sports physical, and those are pretty vital for detecting things that we may not catch on a normal day-to-day basis. Adolescents should be allowed time to speak with their doctor alone, and if the doctor notices mental health concerns, they'll make a referral to a mental health professional for more help. Typical vaccinations, we talked about in our last video, kindergarten vaccinations. Once we're done with kindergarten vaccinations, typically we get a vaccination before entering 6th grade or age 11, and then again at age 16. You're going to see a Tdap, which is a change from a DTaP that we got when we were younger. A Tdap has more tetanus, less diphtheria, and acellular pertussis or whooping cough, meningitis, meningitis B, HPV, and influenza. HPV is not yet required in Indiana for adolescents. However, it does protect from multiple strains of the HPV virus that can be contracted and cause cervical cancer. And unfortunately, that can be contracted even through touch. So condoms do not protect against it. The goal of starting at age 11 is to get children protected before there's any chance of anybody touching anything. Here's my slide about why you should vaccinate for common childhood illnesses, childhood mortality, loss of life and limb. We don't like childhood coffins. What to know about 11 to 13 years of age. These kids are becoming very independent. Even though they may act independently, they still have very little concept of what's really going on in the world. It is our responsibility as adults to make sure that they are safe, despite them being more independent. And they need support. Puberty is hard. Peer pressure is hard. Stay involved and keep talking. Start doing less for your adolescent and let them have the consequences, both good and bad, for their actions. This age of child needs at least 8 hours of sleep a day and may need up to 12 hours of sleep. No electronic devices in their bedroom, including cell phones, tablets, or TV. This is both a safety and a sleep hygiene. Children, especially adolescents, are very geared towards technology and they can't turn it off. And if it's in their bedroom, they will not sleep. So both for sleep and safety, no cell phones, tablets, or TVs in bedroom. Limit your screen time to less than an hour per day. I know with the way that schools are now, that's almost impossible. And help your adolescent think through their options of choices, including positive and negative consequences of their choices. 14 to 17, Start making sure they're involved in community service or continuing that from previous. Make your rules clear and use it to protect them, and approach your rules as being part of being safe, and typically they'll be more well received. Providing fresh fruits and vegetables. Older adolescents really need a space to call their own so they can develop their own sense of self. Letting older adolescents participate in adult parts of life, like understanding bills and money, how to use a bank account, to call services on the phone, like how to order pizza, how to talk to an insurance company, how to call and make an appointment at a doctor's office. Knowing that understanding each other is going to be difficult at this time. Make time to have open and honest conversation. Be a role model. Know your teen's friends and parents. And talk with your teen about big decisions like sex, drinking, and smoking before someone else does. These are your priority safety topics. We've moved away from all of the burns and drownings and those kinds of things, although they still happen. We are more focused on accidents and the dangers of becoming more independent. So car crashes are still leading cause of death in adolescents. Children can fall from a bike, scooter, motorized vehicle like ATV, even in a driveway. And traumatic brain injuries can happen even at home. As their risk-taking behavior increases, so do the risks for accidents that result in permanent physical damage. These kids are typically more active, and the more active we get, the more risk we take. So having that protective gear on is pretty important, especially a helmet. The independent dangers of knowing where your adolescent is and who they're with. Not allowing them unrestricted or unmonitored internet access. And illegal activities like drinking alcohol, tobacco, and drugs are all becoming more of a risk during this time. Your illness entry and death prevention, going back to those priorities that we just discussed, making sure your teen wears a seatbelt in every car, wearing a helmet in every time she rides a bike or an ITV, getting your vaccines, paying attention to your child, simply monitoring for mental health crisis, changes in personality like becoming withdrawn, lashing out, or increasing in risk-taking behavior. Know where your child is and know who they're with. Monitor their internet and cell phone use if they have to have one. Let your teen know they can always call you to come get them at any time in any situation if they are in trouble. Have your teen take a CPR class with you. Have them avoid water without direct, undistracted attention from an adult. Even teens can drown. Make sure all firearms are locked away in a gun-safe, biometric preferably, and teach your adolescent about gun and hunting safety. And teach your child about skin cancer risk, and don't allow them to use tanning beds. If you want to learn more about raising a teenager, which is difficult, especially those early adolescent and middle adolescent years, there's some reputable websites I provided here for research, both the parenting website from the AAP called Healthy Children. There is the American Academy of Pediatrics, the AAP.org, if you need more medical advice. And then the Center for Disease Control, the vaccination schedule as well. But first and foremost, talk to your pediatrician or school counselor. They are much better equipped and have seen much more than parents who are just finding out how to deal with a teenage child for the first time, because we all know that they did not come with a handbook. I really recommend you talking to your pediatrician or school counselor if your child is encountering any problems, and get your child help as soon as possible if you detect issues. Here is a reference slide for websites that I used to create this. And if you will at this time, please review this and go ahead and take your post-test. And if you're done with your post-test, please enjoy that handout and feel free to ask any questions and take questions to your pediatrician. Thank you.